Come in.
Hi, how are you?
Good, thank you.
Good, my name is Tammy. I'm a student nurse practitioner here at Dr. Jones's office.
Nice to meet you.
Nice to meet you. Are you familiar with nurse practitioners at all?
Yes, actually I am.
Okay. So how would you like me to address you?
Well, I'm Jenny. You can call me Jenny, and this is my son, Joe.
Okay, all right. Well, nice to meet you both.
Nice to meet you.
All right, so what brings you to the clinic today?
Well, Joey is 8 months old, and he has been pretty healthy otherwise, but lately, the last 3 days, he's been really fussy.
Oh, no.
And he's had a fever and runny nose and just a couple loose stools, so I was concerned.
Okay. So when did all of this start?
Well, about 3 days ago I noticed.
Okay.
And he's just, he kind of looks miserable. He's not eating much. He's breastfeeding all the time.
Okay, so you're breastfeeding?
Yes.
That's good, that's good. How often do you breastfeed?
Oh, probably right now it's about every hour he wants to.
Okay. Does that make it better? Or do you feel like that suits him? Okay. Okay. Any sort of, you mentioned just not feeling good, runny nose, loose stools. How many would you say he's had?
I just 2 this morning.
Okay. Okay. What color were
Just
they?
brown.
Just brown. Soft stools?
Yeah.
Loose, okay. Moving around. Has he been moving around like he normally would, or is he been
Oh yes,
sort of
he's
sedentary?
pulling himself up. He's moving all the time, crawling everywhere.
Okay. Irritable at all?
Yes, very irritable and fussy.
Okay. Anything make it worse?
Not really. Nothing that I can think of that makes it worse. Just it helps when I give him Tylenol and when I nurse him and just help and cuddle him.
Okay. Have you tried any sort of cold application to the gums, anything like that?
Well, when I use his teething ring, that helps, and when I put that in the freezer, that helps.
Okay, good, good. Does he currently have any teeth right now? He has 4 teeth. Okay. And I notice his gums look a little swollen. He's been really sucking on his fingers more, but he's also, I took his temperature, and it was axillary. It was 100.2 yesterday in the morning, 101.4 in the evening, and then today it was 101.2 this morning. Okay, and you said you've been giving Tylenol for that?
And that helps.
Okay. How much Tylenol have you been giving him?
I've been giving him 1 teaspoon every 4 hours.
Okay. And you've been giving this to him for how many days now?
Well, I'd say it's been 2 to 3 days.
2 to 3 days? Okay. And that helps, you said. Good. Any other medications?
He gets a multivitamin. It's called polyvitamin. It's they're drops that have fluoride in them.
Okay, all right. Any allergies at all?
No.
No. Okay. Looking here in the chart for the past medical history, I see that the pregnancy was well, no problems. Delivered at 40 and 1 7 weeks gestation.
Yeah.
Let's see, at birth the APGAR was 8 and 9, and an APGAR is just a scale that we use to determine how well the infant's doing at birth, okay?
Okay.
And you said you're currently breastfeeding, that's good. Any other foods that you've been starting to give him?
No, maybe a little cereal.
Okay.
I did try that.
All right, just the cereal, and has he been tolerating that okay?
Oh yeah.
Good, good. Let's see, all immunizations look like they've been up to date, so that's good. And you have an appointment coming up for the next set of immunizations and a well baby checkup, so we'll keep that. All the developmental milestones look like they've been pretty on track the whole time. Any trauma or other sicknesses or anything like that that he's had? No? Okay, all right. So just looking
over the family medical history. I have here that there's no significant family health concerns.
No.
Okay. And currently, right now, is there anybody that's sick in the family?
No.
Okay. So you and your husband have one older child in the home?
Yes.
Okay. Do you guys smoke in the house?
No.
No. Do you live in a city or in more of a rural area?
We live in a small town.
Okay. The child, the baby, does he sleep in his own crib or does he sleep with you guys?
He sleeps in his own crib.
Good. How are his sleeping habits? Does he sleep pretty good throughout the night or is he up often?
He wakes up quite a bit right now, which is unusual, but you know, if I cuddle him, he'll return to sleep.
And he, does he go to a daycare or any sort of program like that?
Yes, he does go to daycare 3 days a week, Monday, Wednesday, and Fridays, but they, you know, with this fever, he can't go until he's fever-free for 24 hours.
Okay, that's good. So, regarding the situation now that he's in, have you noticed any rashes anywhere on his body?
No.
No. Any lethargy or just being really tired? You said he's been pretty active. Are there any moments where he's, you know, just not feeling well and not moving as much as he normally would?
No.
Okay. Have you noticed any sores in his mouth?
No.
No. And he's been breastfeeding okay. Does he usually breastfeed for long amounts of time or is it just short sessions?
It seems like it's just continuing forever.
Okay. Let's see. Pulling at the ears, have you noticed?
Yes, he's pulling at both his ears, and he seems to be biting more.
Okay. Any drooling?
Definitely.
Okay. Any blood that you've noticed in his stools at all?
No.
Okay. His urine output, do you notice, you said he's had lots of loose stools, but have you noticed his urine when you change his diapers? Is that the wet diapers? Is that decreasing at all?
No.
Okay, good. And the fevers that he's had, they've all been under 102?
Yeah.
Okay, good. All right. Well, let me do a physical exam on little Joe, okay?
Mm-hmm.
If you have any questions or any concerns during this, please let me know.
Okay.
All right. So I see that the medical assistant was in here and checked some vital signs before I came in. Everything looked pretty good. Slight temperature, though, I noticed it was 100.7.
Mm-hmm.
When was the last time you gave Tylenol?
It was probably at 5 this morning.
5 this morning, okay. So it's been a little bit.
Yeah.
Okay. So I just want to do a basic assessment. I'm just going to look at the, listen for the heart and lungs first, okay?
Okay.
I'm just going to, little Joe, I'm just going to listen into your heart. Listen to it. Here we go. Both sides of my stethoscope. Good. And then I'm just going to listen to the lungs. Just going to sit him up for a minute and listen to his back. There you go. Good.
What a good baby.
Very good, baby. Now listen to the stomach while I'm here, too. See if that looks and sounds okay. Wonderful. Don't notice any tenderness at all when I push, so that's good. All right. I'm just going to clean my hands real quick. And then I'm going to look in the nose and the throat. Grab my little light. Okay, I'm just going to look in your mouth. Okay, look at those gums. Lots of drool there, and they are a little bit on the red side. Alright, I'm going to look in your ears real quick. Yeah, they are a little bit red. pulling at him a little bit, huh? Okay. Set this back up here. I'm just gonna take the diaper area off here for a moment. See if there's any rashes or anything. Okay. Alright, no poopy diaper right now, and that's a good thing. Move this over here. Alright. So I'll just go over a few things with you.
Okay.
Little Joe is nice and calm. So what I think is that he's getting some teeth in there. I can see little areas where some teeth might be breaking through. That's just bothering him a little bit. Also his ears, there's a little bit of redness in there, so that might, become an ear infection. It's a little red. The eardrums, they look intact and everything. So we'll just watch it for a little bit for now, make sure that it doesn't become infected. It's a good thing you're breastfeeding. That's very good. Just let him breastfeed as much as possible. If that helps continue with the cold on the gums, that's a good thing. And then the Tylenol, keep giving that. If that works for him and to help decrease the temperature, keep doing that. That's a very good thing too. Do you have any questions for me at all?
I don't think so.
Okay, alright. Well, if you think of anything at all, please feel free to let us know, okay? If you have any questions, otherwise just come back during your normal scheduled well child visit,
Okay, we will.
Alright, good luck to you guys.
Thank you.
Mm-hmm.